So hello everyone, our today's topic is a viral infection. So here we shall be discussing about the first, that is the herpes virus. So the herpes virus, as we know all, that it is an enveloped virus of size 100 nanometer in diameter. So the herpes virus, they are family of double-stranded DNA viruses. Remember for your exam, the herpes virus, they are the family of double-stranded DNA virus. Now what are the various types of herpes virus? They can be herpes simplex virus type 1, type 2, type 3. Type 3 is also known as varicella zoster virus. And type 5, that is known as cytomegalovirus. More recently, herpes virus types 6, 7 and 8 have been discovered. The type, remember the type 8 is known as Kaposi sarcoma. Human herpes virus type 1 is primarily the mode of transmission it has a mode of transmission primarily through the direct contact with the infected oral secretions or lesions. It can be spread through kissing, sharing utensils, or coming into contact with the saliva. Human herpes virus type 2, the mode of transmission here, it is through the sexual contact, through the genital area. It can be also transmitted from mother to newborn during the childbirth. The human herpes virus type 3, that is also known as varicella zoster virus. It spreads through the respiratory droplets. From infected individual through coughing, sneezing. It can also contact through the with the direct contact with the fluid from the chickenpox lesion. Type 4 is known as Epstein-Barr virus. The mode of transmission is mainly through the direct contact with the infected saliva or through kissing. Human herpes virus type 5 is the cytomegalovirus. The mode of transmission here is through close personal contact with infected bodily fluids through urine, saliva, and the blood. Type 6 and type 7, they are transmitted through saliva or respiratory droplets. The type 8, that is also known as Kaposi sarcoma, it is transmitted through the sexual contact in the immunocompetent individuals. The human simplex virus type 1. The herpes simplex virus, also known as HSV, is an infection that is caused by herpes. The HSV type 1 primarily causes oral herpes. and it is responsible for the cold sores and fever blisters. Whereas type 2, it causes genital herpes and it is responsible for genital herpes outbreaks. So what is the most common site for the latency of herpes simplex virus? It is the trigeminal ganglion. So the virus will travel along the sensory neurons axons between the skin, mucosa and ganglion. Suppose a person is initially exposed to HSV1 infection. The virus will enter the body through break in the skin or mucosa, usually in or around the mouth area. So what will do, it will start replicate in the cells at the site of entry, causing the characteristic cold sore lesions. So once the virus replicate at the site of entry, it has ability to invade nearby sensory nerves. So these nerves carry signal from the skin to the central nervous system. So the HSV1 virus, it travels along the long projection of the nerves cells called the axons. So these axons can be thought of a wires that are connected to different parts of the nervous system. So the virus, it is transported in a backward direction, moving from skin toward the nerve cells, which is located in the ganglion. So once the virus reaches the nerve cells in body in the ganglion, it enters a latent state. So what does that mean? The latent infection, that means the virus becomes inactive and it does not cause any symptoms. It hides out in the nerves cells. So periodically you will see the virus, it will reactivate from its latent state. So what are the factors that cause it to get reactivate? Various factors like stress, illness or weakened immune system, they will trigger this reaction or reactivation. So the virus will become active again, travel back along the axon to the skin or mucosa and cause new symptoms like cold sore. So the recurrent HSV1 infection, it happens when the virus, it becomes active again. That can be triggered by things like getting older, sunlight, stress, being tired, extreme temperature, pregnancy, allergies, dental work, sickness, fever. So these are the reason for the virus to get triggered. So when the virus will become active again, it can cause symptoms or not show any signs. More often the virus become active without causing any symptoms. So this is known as asymptomatic viral shedding. The crowded living conditions, poor oral hygiene, they increases the chances of getting exposed to type 1 viral infection. The acute herpetic gingival stomatitis, it is the most common form of primary herpes simplex virus that is caused by herpes simplex virus type 1. So remember, it occurs in children age 6 months to 5 years. That is very important for your exam point of view. It occurs in children age 6 months to 5 years, peaking at second to third year of age. So what is the symptoms? The infection usually starts with the symptoms like fever, chills, sore mouth, and swollen lymph nodes. There is vesicular and ulcerative lesions, gingival, stomatitis, and malaise. So these are the most important features. The mouth lesions, you will see small vesicles form initially. They collapse into red lesions that become bigger and develop a central ulcer covered by yellow fibrin. The gums are painful, swollen, and very red. So the rare complication may be seen including the eye infection, esophagus inflammation, lung inflammation along with that. Primary infection in adults commonly causes pharyngitis and tonsillitis. So vesicles form on the tonsils and back of the throat that can turn into ulcers with grey-yellow covering. Other features are keratoconjunctivitis. Infection in the eye produces severe conjunctivitis, encephalitis. The recurrent herpes infection can occur when the virus it enters into nearby area supplied by the same nerve ganglion. It often reoccurs at the vermilion border of lip, termed as herpes labialis or cold sore. Some lesions may be seen on the fingers, that is known as herpetic white flow, and the bodies of wrestler. The term we use here is herpes cladioratum. The herpes infection on the fingers, it can occur due to the self-inoculation from oral herpes simplex 1 in children. Eczema herpeticum, it is a primary infection in the HSV1 in person with the chronic eczema. People with the skin condition like eczema, pemphigus, and diarrhea disease may experience life-threatening herpes simplex virus infection that are known as eczema herpeticum. Newborn can also get infected during the birth, usually with the herpes simplex virus 2 from the contaminated birth canal, as the route could be genital or the sexual route. Coming to the clinical diagnosis, clinician can often diagnose the herpes simplex virus based upon the symptoms and appearance. The lab confirmation might be necessary due to the confusion with the other diseases. Second, one can do is viral isolation. So you can do is growing the virus in tissue culture from the fluid of the intact vesicle. But since the intact vesicles, they are rare in mouth, and rupture lesions are unreliable as they are the source of contamination. Third, cytological smear and tissue biopsy are common method. Additional tests like direct immunofluorescence, immunohistochemistry, PCR, they provide a more definitive detection of herpes simplex virus. The biopsy of the persistent ulcers in the immunocompromised patient should also be tested for the cytomegalovirus infection, as their histopath features can easily be missed. Serology also helps to confirm the recent or past herpes simplex exposure. Now, what is the treatment? The treatment for the herpes, antiviral drugs are given. Pain relief can be given like medicaments like dicyclonine, hydrochloride spray, tetracycline, or NSAIDs can provide the pain relief. The patient should avoid contact with the active lesion to prevent its spreading. The recurrent herpes labialis various treatment includes that are topical ointments like acyclovir, systemic medicaments like acyclovir, valacyclovir, famciclovir, they are effective. Newborns and person with eczema should be protected from exposure to person with active herpetic lesions. So remember, the acyclovir is the current standard treatment